I can't emphasize enough how high of quality the care that is given here in this facility, as well as how nice of a community it is to be a part of here. This is where I wanted to be. I wanted to be at the bedside caring for people. And we fell in love with the rural community. We had lived in a larger city, and there's a lot to be said about a rural community and how much that community is part of your family. Through technology, been able to not only provide excellent healthcare here in our small community, but be able to reach out with other technology to get people that are in a rural community some of the specialties that they need to have.
We are so lucky. Not only do we have our hospital, and actually we have 2 clinics in town. We have a surgeon. A lot of small hospitals do not have surgery available anymore. We have the optometry within the community. We have mental health in the community. We have drug and alcohol counseling. We have 2 pharmacies. We have physical therapies. We have chiropractic. So we are able to provide a holistic approach to healthcare, which I think is quite unique for our community.
I graduated from medical school at the Medical College of Virginia in '99. I did my orthopedic residency at the University of Iowa. I did 2 fellowships, one in sports and arthroplasty and another one in foot and ankle at the Musculoskeletal Institute of Australia in Sydney, Australia. And then I was in practice for 14 years with a private practice group in Roanoke, Salem, Virginia. And then I moved to South Dakota 3 years ago. So people ask me that all the time. Why not? It has been an absolute blessing to come here. It has reinvigorated my life. If I could bring my colleagues where I've practiced before somewhere to talk about how can you really take care of patients and really do it in a good way, and I would bring them all to this setting, without a doubt. We have good days and bad days, but this system really does try to pull together to do what's best for patients. And it all is from the top down, because the vision is the mission, and the mission is the vision. And because we're doing that, people here have no idea the gift that they have in the healthcare system here in South Dakota.
So the hospital and the nursing home are heavily involved in the community. We work heavily with the schools in particular. So when I first moved here, one of the most exciting things to me was you show up and you start driving around town, and the entire downtown is full. There's a lot of new businesses, a lot of energy going around town with places that are doing very, very well.
One of the major things in rural South Dakota especially is people intuitively know that healthcare is a scarce resource, and because of that I feel that people tend to be more appreciative of the care that they receive, especially in their hometown communities. They have a high degree of respect for their healthcare professionals. You're able to see the people and patients that you treat in the community as well, whether it's the grocery store or out for supper or whatever. It's you run into people quite frequently.
You know your neighbors know you. Our school system is wonderful. The swimming pool, the library. There's so many things for kids as they grow up. And it's nice to be in this open area where you feel safe to let your kids walk to the pool or walk to school.